So what I'm going to talk about today is what the doctor will look like in 2089. We don't know whether doctors will still be human then. We don't know whether there'll be a network controller and the doctors will be holograms or robots. We don't even know what health will look like, whether there'll be more or less. But as a doctor myself and as an educator of the doctors of the future, this is something I think about frequently. And if any of you decide to go into medicine, we'll probably still teach you how to take a pulse and measure of blood pressure. But over the course of your professional lifetime, your role as a doctor will change dramatically. Now today, you'll hear lots of speculation about what the world would look like in 70 years. We do know that there'll be many changes in the world by then, and that these will have a profound impact on society and the Earth. For example, if the Earth is even 4 degrees warmer, the diseases that are carried by mosquitoes, such as Zika virus and malaria, may well be greater. There may be more of them. And we also know that over the past 40 to 50 years, we haven't been able to do anything to eradicate these diseases. We know that bacteria, viruses and parasites tend to be better at adaptation than we are. We also know that the population will be older and that many of you in this room will still be alive, despite what Rob says. We also know that technology and artificial intelligence will have a huge impact on what healthcare looks like and its delivery, and that many of these changes are already happening now. For instance, in England, there's a company called Babylon Healthcare. They have already automatised and developed an application to manage many of the common reasons that people see a GP. So if you put in your symptoms, it can tell you what to do, and you don't even need to go and see a GP even today. Implantable medical devices are already being used and have revolutionised the treatment of conditions such as cardiac arrhythmias and diabetes. The information goes remotely, currently to a doctor, but eventually it might be to a programmer or just a robot, and they tell you what to do. Medical 3D printing is already being used to print orthopaedic prostheses. So if you have a problem with a vertebra or a joint, you can actually print a bit of bone to replace a worn-out one. In 70 years, this will have progressed to wearable nanotechnology clothing, which will incorporate components that allow personal function and maintenance beyond the ability of the current human body. So for example, if you have a disease, metabolic disease or developing cancer cells, you may be able to get information about this before any problems have occurred. If you have an injury, medical nanobots may be able to seal a wound or regenerate a bone. Medical devices in these outfits will be able to monitor for disease at all times and respond automatically to make you well again. When human bones get old and the skeleton begins to fail, it's likely that this clothing will be able to maintain your movement and your function much better than the human body can today. So many of you in this room will still be able to walk around, even run marathons easily. One other thing that I'd like to mention that will make a big difference to the role of a doctor is knowledge about the human genome, as you've already heard about. Many people, and probably some of you in this room, are already getting their genetic blueprint analysed. Currently, the best information is about things like the cancer genes, but we can also learn about a person's predisposition for diseases like diabetes, psychiatric disease, drug and alcohol addiction. We can also learn about your propensity for your urine to smell after you eat asparagus, although we can't do anything about that. Anti-cancer treatments are already being developed on the basis of biology and genetics of an individual's person's tumour. And this kind of information will be key to the development of personalised medicine right from the time of conception. As you can see, underpinning many of these developments and many of these technological advances is the use of data. By using this data, it's almost inevitable that AI will be able to work through many of the simple diagnostics and formulate simple management plans. But I predict it will still fall down when it comes to very complex patient management. I think that the irony of technological progress will be that medicine will require doctors to have more of the human skills. And just for a few seconds, I'd like you all to think about what you look for in a doctor. Is it an extensive knowledge base? Is it high-level technical skills? Or is it something else? And does this something else involve trust, empathy, good communication skills? We'll come back to those things later. As I mentioned, I think that AI will be able to manage mainstream problems, but human doctors will still be needed to kind of understand and deal with the more complex medical problems where data cannot predict, explain, or manage humans. For example, as we've heard, technology may help us to devise the most appropriate chemotherapy to deal with the cancer, but it may not be able to help us work out when a patient has had too much, when the burden of treatment is too much for a patient to want to continue. These are human, personal, and unpredictable decisions. Now I'm going to come back to those human qualities of doctors that I just mentioned, and why sometimes medicine involves embracing a total lack of logic. We have questions like, as you've heard, why do people smoke when they know it causes cancer? Why do diabetics eat too much sugar? And why do people stay in relationships that they know are toxic? Until we have these answers to these questions that get down to the very core element of the human condition, it will remain impossible to code for these things, because let's face it, humans are so highly illogical. Let me illustrate this by telling you some anecdotes. I recently had a final year student. He was only 4 months away from his exam. He was top level. He was still doing research on the side. He knew what specialty he wanted to go into and had his career trajectory all mapped out. And suddenly he stopped attending clinical attachment. So I called him in for a chat to find out what had happened. And it turns out he'd stopped being able to sleep. He'd stopped being able to leave his house. And so despite being as close to a human Vulcan as I can imagine, he couldn't understand or work out what to do with what had happened to him. Luckily, we were able to use the moment to expand his knowledge about the human condition and also work out some self-care strategies. But I use this anecdote to illustrate how frail and unpredictable the nature of the human condition can be and how hard this will actually be to code for. My second anecdote has to do with a patient I saw a few weeks ago. He'd been referred by a surgical colleague, and I had seen him 5 years ago for something completely different. He came in and he asked me all about my daughter. It turns out that the previous time I'd seen him was the day she got her ATAR. He even knew what marks she'd received, and he wanted to know what she was doing at university now and how she was going. Over the next few days, it came to pass that he needed to come into hospital for ongoing management. So my surgical colleague's assistant rang him to tell him to come in, and he said no, ignored her completely. The next day she rang him again. He still ignored her. When I found out about this, I gave him a call and we chatted for a few minutes, and then I said, look, you need to come into hospital so we can manage your condition. He came in straight away. What had transpired was simply that despite we were both giving the patient the same information, trust was the most important thing in him making decisions about his own healthcare. And I think it will be hard for patients to develop this kind of relationship with inanimate objects. Ironically, in the future, doctors will probably need to have more of the human skills that we thought about. I think that in medicine in the future, technology will be our partner, but not our replacement. The doctor of the future may in fact need to be more like the doctor of 1949. Someone in whom you can confide, trust, and who may help you put the solutions that technology offers you into the context of your own life in terms of healthcare decision making. Thank you.